Acute lymphocytic leukemia is the most common type of leukemia in children and the least common in adults. Leukemia is a term used to describe the type of cancers that start in the lymphocytes of the bone marrow. Leukemia is brought on when a malignant tumor invades the bone marrow and the blood-forming cells replace the normal bone marrow with malignant lymphocytic clone cells. This invasion results in a loss of T or B cells. Lymphocytes are the body's main way to fight infection, so when the number of healthy lymphocytes is decreased, the person has an increased risk of infection. Mature white blood cells evolve from immature cells called blast cells. Blast cells make up about 5% of healthy bone marrow. When someone has leukemia, these blast cells remain immature and multiply continuously and can make up 30 to 100% of the bone marrow. These malignant cells prevent the production of mature white blood cells, healthy red blood cells, and platelets. During acute lymphocytic leukemia, the disease progresses very quickly and many immature white blood cells are present. This is a picture of normal blood cells, and this is a picture of lymphocytic blood cells. Symptoms of acute lymphocytic leukemia include fatigue, recurrent infections, bone pain, bruising, slow healing of small cuts or abrasions, uncontrolled bleeding, and petechiae on the skin. If a patient presents with these symptoms, the doctor will do a series of diagnostic procedures, which include a physical examination, blood test, a bone marrow biopsy, and a spinal tap. During the physical examination, the doctor will look for signs of enlarged lymph nodes, enlarged liver, and enlarged spleen. The doctor will also check the body for any bruises or signs of bleeding. A complete blood cell count is performed to count the number of white blood cells, red blood cells, and platelets. A patient with acute lymphocytic leukemia has a higher than normal white blood cell count and a lower than normal red blood cell and platelet count. If the blood tests are abnormal, a bone marrow biopsy is performed. If the bone marrow biopsy confirms that the patient has an abnormally high number of immature blast cells, then a spinal tap is performed to see if the leukemia has spread to the central nervous system. Tests after diagnosis of leukemia include cytochemistry, flow cytometry, and immunophenotyping, which are performed to determine the specific type of leukemia. Acute lymphocytic leukemia makes up almost one-third of cancers in children. Out of all the cases diagnosed each year, 2/3 occur in children and only 1/3 occur in adults. It is most common in children between the ages of 2 and 4. Adults over the age of 50 have a higher risk than younger adults. Acute lymphocytic leukemia can cause death within a few months if it goes untreated. If treated, children have a very high cure rate of 80%, but adults only have a 40% cure rate. Another factor that can affect the prognosis is if the T cells or B cells are affected. T-cell acute lymphocytic leukemia has a better prognosis than mature B cell. Leukemic cells that have the Philadelphia chromosome also have a poor prognosis. The quicker that a patient has complete remission from chemotherapy, the better the prognosis. Common medical treatments for acute lymphocytic leukemia include chemotherapy, radiation, and if there is no remission after chemotherapy or the cancer returns after treatment, a bone marrow or stem cell transplant may be performed. Impairments associated with this disease include decreased joint range of motion, decreased strength, and decreased growth and fine motor performance. Some of the functional disabilities include impaired balance, decreased coordination, and decreased endurance. A few examples of disabilities include a child being too sick and too weak to attend school, or an adult missing work because of disabling fatigue following chemotherapy. The focus of physical therapy with patients diagnosed with acute lymphocytic leukemia includes strengthening and energy-enhancing programs which can reduce the fatigue and many other effects of chemotherapy, radiation therapy, and stem cell transplant. Aerobic exercise has been shown to improve energy levels and stamina, improve mood, reduce anxiety, reduce mental stress, reduce fatigue, reduce nausea, and increase muscle mass after patients have undergone chemotherapy. Relaxation exercises and therapeutic massage can provide pain relief for the patient, and it can promote emotional comfort. Stretching and resistive exercises can help to maintain joint range of motion and can help to prevent muscle atrophy. It has also been proven that performing active and passive range of motion exercises can help to preserve the joint motion in patients with osteonecrosis. Patients with this condition are very susceptible to infections, so therapists should follow a strict hand-washing regimen when treating patients. Therapists should look for signs of infection and report any sites that could be prone to infection. Since there are not as many platelets, risk of spontaneous hemorrhage increases. Therapists should be aware of this and take precautions to prevent this. Decreased red blood cells will result in a decreased amount of oxygen to the tissues, which can cause the patient to fatigue quickly. The patient may need to rest frequently during treatment. Patients that have had prolonged corticosteroid use should be tested for muscle weakness and avascular necrosis of the joint. If the patient has osteonecrosis, proper weight-bearing statuses must be met. To maintain the proper weight-bearing status, a walker or bilateral crutches could be used if one side of the body is affected by osteonecrosis, and a wheelchair may need to be used if both sides are affected. The therapist should closely monitor the patient's oxygen saturation, heart rate, pulse rate, breathing frequency, and blood pressure before, during, and after treatment. Patients should not do any type of exercise within 2 hours of having chemotherapy or radiation therapy. Physical therapy may be contraindicated if hemoglobin level is 8 grams per deciliter or less, white blood cell count drops below 500 millimeters cubed, or platelets drop below 5,000 millimeters cubed. There are several things that can affect the treatment plan, goals, and progression in a physical therapy setting. Disabling fatigue that a patient may experience after chemotherapy can affect the plan, goals, and progression. The fatigue could get worse as the chemotherapy goes on, so the patient might not progress as expected. Sickness from chemotherapy can also affect the plan, goals, and progression because the patient might not be able to participate in the physical therapy sessions. The therapist also needs to realize that the patient's condition could change daily, so they should not get discouraged if the patient is not meeting goals or progressing as planned. Physical therapy can help patients suffering from acute lymphocytic leukemia in many ways. Physical therapy can help the patient physically by maintaining muscle mass and range of motion of the joint, improving energy levels, and reducing fatigue. Physical therapy can also help the patient mentally and emotionally by providing emotional support, reducing mental stress and anxiety, and improving mood. Dealing with acute lymphocytic leukemia can be very hard for a person physically, mentally, and emotionally, so physical therapy can be very beneficial to the patient. Thank you for your time. If you have any questions, let me know.